remote ischemic perconditioning is a new strategy of neuroprotection, and it consists in different cycles of compression depression on the limb, and this promotes or induces the ischemic tolerance. So it's a new paradigm of neuroprotection that is safe and expensive, and what is interesting is that you can apply it in the pre-hospital setting. So we include patients in the pre-hospital setting, in the ambulance, and then we apply the RIPerC, and also there was another arm that was a sham. So patients were patients were randomized in the pre-hospital setting, and then they were assigned to the active group and to the sham group. And in our case, RIPerC consists in 5 cycles of 5 minutes of ischemic perconditioning, and then at the arrival of the hospital, we confirmed the diagnosis. Our target was ischemic stroke patients, and then our primary point was the proportion of patients with good out points, which means that modified ranking scale less than 3 at 90 days. And also there was a sub-study of neuroimaging in our clinical trial. First, I think that doing an academic clinical trial is a great challenge, and we are very happy of having these results. And in our study, we observed that remote ischemic conditioning is more efficient in those patients with low severe stroke, and also in those patients without large vessel occlusion, which was something that we don't expect at the initial of the clinical trial. So we had these results last week, and then we have to interpret, to think how our results could change the way we are treating patients. Obviously, our study had some difficulties. First, the pandemic that has slowed the recruitment. Obviously, the insufficient funding. So we stopped we prematurely conclude the study, not with the enough number of patients that we try to include. But with these 200 patients, we observed these results. So we think that remote ischemic conditioning could have a good improve of the neurological evolution of our patients, especially in those patients that initially have low severe symptoms and without large vessel occlusion. So maybe remote ischemic conditioning could act in the post-reperfusion therapy. So we think that we need new clinical trials to confirm our results, or maybe to focus on this kind of patients, in patients that have reperfusion, and maybe remote ischemic conditioning could avoid reperfusion injury. So this is our theory. In terms of neuroimaging, we observed that there were differences in the infarct volume. I mean that in the sham group, the volumes were higher than in the active group, but the differences didn't reach statistical significance. I think that our study was underpowered with this limitation of patients. But we are happy, because we have finished the study, and it was a large path to coming here. And I think that maybe in future clinical trials we could focus in a special patient characteristics. We have determined the modified ranking score at 90 days, but also we have performing in parallel a study of cognition repercussion and also affective symptoms. And maybe it would be interesting to follow up these patients in 1 year follow-up, yes.